we'll have an official inauguration when our doors arrives. That will be after about 45 minutes. So we'll begin with the first talk for the day. That is the role of pharmacotherapy in the prevention and management of macrovascular diabetes complications. The speaker is Dr. Sufyan Uddam. He has done his doctorate in pharmacy from the University of Florida. He has also degree in Masters of Science in Healthcare Management from California State University, Bachelor of Science from Amman University, Jordan, and Bachelor of Science in Mathematics and Statistics from Utah University, Jordan. He is a licensed pharmacist and he has been practicing in the US for about 10 years. And he has been with us and he is an assistant professor in the Department of Pharmacy Practice, College of Pharmacy, Government University. I welcome Dr. Sufyan.
The CPAP below 6.5%. However, we cannot induce by antidiabetic. In patients who have multiple comorbidities, in patients who are more labile or prone to developing hypoglycemia, pushing HbA1c basically have long duration and serious sequelae of severe hypoglycemia. And then the desired outcome manages this as or translated as multiple mortality, right altogether, while deciding how much to the desired mental health. Over 9 years, from 2000 to 2009. It was done in Louisiana. Basically, the study objective was to determine the association between coronary heart disease risk and venous blood pressure particulars in diabetic patients. In African Americans, the hazard ratio was increased when basically significantly low blood pressure targets were utilized. We're talking about the risk for CO5 calculate the risk in 10 years, like in 10 years.
A very good morning once again, ladies and gentlemen. It's such a pleasure to see you all this morning on this second event that we are hosting at the Constituent University in association with the IPWC. At the very outset, it's my pleasure to welcome you all on behalf of our founder president, Mr. Constituent, and acknowledge the presence of the chief guest for the day, our provost, Professor Geeta Shokraj. We should profusely thank her that for over a week she was on a foreign travel. She just reached last evening and today she has agreed to be with us. So very kind of you, ma'am, for being with us this morning. And I wish to thank the Dean College of Pharmacy, Professor Constituent, for giving us this opportunity as a division of Health Communications Division at the University to host this event today. To begin with, I wish to mention that we are going to have a very brief small presentation ceremony where we wish to acknowledge the graceful acceptance of invitation of the speakers. Then we will be hearing a few comments from the chief guest and she will be honoring the speakers of the day. To begin with, may I request my colleague Mrs. Neema to kindly welcome the provost to this special presentation ceremony by presenting her with the trophy. Also, we wish to welcome the Dean, College of Pharmacy, Professor Arun Shirvekar, to this special ceremony.
To welcome you all once again for this event. This seminar on diabetes complications, prevention and management. This is an apt and very relevant theme for UAE especially. According to the report by Abu Dhabi-based Injazat Data Systems, almost a fifth of the UAE's population has diabetes. Most have the type 2 variant, which can be easily prevented by exercising regularly and following a good diet. The highest population of diabetics falls into the 40 to 44-year-old range, compared to the global average of 55 to 59. The gender distribution is a reflection of a rapidly developing epidemic, where younger and younger people are experiencing radical changes in lifestyle, poor diet, and low physical activity. These combined with a low awareness of diabetes will inevitably lead to a rapid pace of development for the disease. So we have to be careful, and pharmacists as a part of the healthcare team has a major role to play. As Dr. Sufyan mentioned, a patient visits the pharmacist more number of times in a day than he visits the physician. So pharmacists can counsel the patient and create an awareness about the risk factors and also help in the management of this disease. With these few words, I would like to welcome you all for this event. I am very thankful to our provost, Dr. Ashok Raj, for being present here to raise this occasion. Welcome once again. Thank you.
Ladies and gentlemen, it's with great pride and privilege I wish to request our chief guest of the day, Professor Ashok Raj, to please come on stage. First to say a few words and then to honor the speakers of the day. Can I hear it up for Professor Ashok Raj?
It's a great pleasure to be among you, to welcome you to the university. Ultimately, university is very high on community engagement, and we encourage every college in the university to organize events which brings together members of the community who are very active and are actively participating in the health sector. It is not just the universities who are busy providing skilled professionals who can work in the community. But we must not forget that once they graduate, they are placed in the community, in the right place at the right time to serve the members of the community who are plagued with various illnesses. So far, the emphasis has always been on treatment, management. Today we can see that the topics which are being listed out don't just concentrate on management alone, but also on prevention. In fact, diabetes is one disease which can be prevented up to a point. As was mentioned earlier, we have younger and younger members of the community now that will be diabetes. Also, as we prevent diabetes, and we can hope that the duration of the disease when it ultimately develops will be lesser, which means that the complications which develop over a period of time can be reduced considered this photograph was interesting that the patients see a pharmacist more often. It is true. The pharmacist is in the community, is easily available, and it seems that he is there for them all the time. So patient is more likely to consult the pharmacist when he or she wants to know something more about the medication that they are taking. In fact, I find members of the pharmacy community today placed in all different parts of the health sector. We see them not only just within the pharmacies, today we see them in hospital settings, bedside settings, within pharmaceutical companies, and more in research communities. We find where clinical trials are going on, more and more pharmacists are required to become the SMOs and CROs in this venture to monitor the interventions which are taking place, to document them, to record them, and eventually to provide evidence that the intervention which took place was of some value. Today you have a large number of topics which are being presented by speakers who have prepared them for you, and I do hope you are able to take home some valuable information, reinforce your own knowledge and skills related to this disease, and help in the prevention and management of its complications. With these few words, I welcome you all to this session.
I will request you to kindly present the mementos to the speakers of the day, and I request our Professor Arun Shiveke to kindly join the teachers from the stage while she does the honors. I request my colleagues to assist me while I take the name of Dr. Sufyan Altoum from the College of Pharmacy, Gulf Medical University. I accept the memento to the hands of the provost. I request Dr. for this session. I request all the
my team at IPWC is really proud to welcome you all to the second GMU program, which we are doing in partnership with Gulf Medical University. After the success of the first GMU in March, we have together with GMU agreed to take it forward with college education program, which we strongly believe can go to great heights. Can even go from the education sector research sector, as Professor Arun Shiveke was mentioning. The possibilities of partnership remain immense, and we definitely will have all the opportunities available in future. At this juncture, IPWC would like to thank our sponsors, Original Camp, who are the makers of Pharmaco, and was kind enough to sponsor. We would like to thank you, Original and team, for I appreciate their foresight and vision in supporting pharmaceutical community and continuing with the program. The second sponsor is GSK Consumer, who has been always a pillar of support in almost all our events. And this partnership has a very long-standing history. So we thank GSK and their team for being with us again. Thank you. Today we have a new partner with us, which is Unilever, for the makers of Dove and Vaseline, and who have decided to extend their partnership with IPWC. So we thank them for joining with us today. Thank you. This GMU would not have been complete without college education in place. So I would like to thank our own speakers, along with other speakers from GMU, who are Dr. Lasira, vascular surgeon, Dr. Soundaraj, dermatologist, as well as Dr. Balan Vijay Kumar, who is joining us in the afternoon today, is a psychiatrist from Charlotte. We are all here to enrich our knowledge and expertise. So their lectures will support us in this endeavor. My important message to our fellow IPWC members is that you are the foundation stone and the bricks and bones of the association. Your active participation and involvement in the coming activities will lead to the success of the association and will give us energy and enthusiasm to conduct more and more events like this. So keep up your active participation in the future. As you know, lots of effort has been put together by the GMU staff under the guidance of Professor as well as Mr. Ravi, as well as members and executive members of IPWC and over the last couple of weeks and days. So I would like to thank all their efforts in putting this things forward and their teamwork.
These few words, ladies and gentlemen, and leave the session to the chairman of the conference, Professor Constituent, and we wish to thank the presence of our chief guest, Professor Profusely thank you, ma'am, for being with us today, and also to all the speakers and the delegates for making this event such a big success. Thank you so much. Hope you will enjoy the hospitality and the scientific feast on offer for the rest of the day, and God bless you all.
So we will continue with the scientific sessions. I would like to introduce Dr. Mukesh Kumar, who is giving a talk on addressing medication errors which can improve patient safety in diabetes care. So he is staff of the GMU. So he has about 3 years of experience. He has completed his PharmD from India, from Manipal University, and he is teaching these PharmD students for the last 3 years. He has been specializing in medication errors. He is doing a lot of research in medication.
Simple dosing, convenient combination of one dosage because plasma
Everybody is doing general surgeons, GPs, and urologists. Like those others, they are doing wonderful services. But today, I am telling you one of the common complications we have noticed. Diabetic foot ulcers are the common and estimated to affect 50%, and diabetes is very less, 10% only. Once again, this and 85% amputations are preceded by diabetic foot ulcers. That's why I will talk now. It is a very active cloud lines and demarcations are there. These are vicious infection to the leg. Once it start will in the forefoot or dorsum of the foot, it will extend like anything.
We have to identify border to try to scrap with the glass line. There will be no state. This is a condition known as accredited nigricon, one of the cutaneous markers of diabetes. But not only in diabetes, but also seen in other hormonal diseases like thyroid, and frustration. Many of us are obese. We go to a woman and will ask it may lead to any source. So please remember, accredited nigricon is one of the cutaneous markers of granulation or somehow a job in America and Africa, where these fungal infections are very common. One of the progressive infections known as plasmapheresis. This is caused by plasmapheresis dermatitis, and this commonly seen in people who are immunocompromised, like AIDS patients or diabetic patients, and pharmacotherapy chemotherapy. Of course, in our country, our PhD is not seen, commonly seen in North America as well as in Africa. So I don't want to much get off it. The right contact or the patient's inflammation. Such interactions can increase the pharmacokinetic properties and increase the toxicity of glycemia. You can see here carbamazepine, phenytoin, John's wort. They can also interact with herbal medicines. Can also interact with this medication. And you can see they can inhibit. Naticlinide inhibits the effect of sulfonylureas. So such tetraglutamine is first generation sulfonylurea. And you can see that naticlinide should not be given with other medications because it's only used as antibiotics for patient with diabetes. You can see that atorvastatin levels can also be decreased, and such affects statins, basically statin. You can see the rosiglitazone can decrease the concentration of other drugs. That's why you need to know. So let me use some example of they are very much affected by pharmacokinetic interactions. You can see that they can be affected by no sedative, nothing. It does not cause harm to the heart. But metformin is not to produce anything. It's very on the mind that the course of some patients with other particulars is very important. Better to reduce the dose or better to stop engaging the protein. You can see that acidosis can happen in patients with insufficiency and patients with fibrosis. So that's one inform the doctor that is better to
especially here in Korea, what before you eat, we started powerful and active, but the problem to all of us, once after 1 o'clock after we sleep, Dr. Taifu shows us. Dr. Amira said that that's the problem. After lunch, all blood supply go to our GI tract. Then, no sufficient blood going to our brain, so there is no concentration at all. Integrated formula of vitamins, minerals, and calcium. Okay, calcium is from the call it G115. I think also after pharmacy, see in the package from the phone, G115. What think that's good for doing our knowledge. Taking the